Hi everyone, I'm here at Progressive Orthodontic Seminars. We're home office in Southern California in Aliso Viejo, and I'm here with a very dear and old friend of mine, one of the smartest dentists I've met, and actually one of the most, if not the most successful dentists, at least in my circle, that I have ever met. A dear friend of mine and phenomenal dentist, Dr. Agim Heimer from Melbourne, Australia. How are you doing, Agim?
I'm good.
It is so good to have you here in Southern California. You're teaching a seminar today and this weekend, and I can just tell you the students are so lucky to have you. Just sitting in class with you, listen to your lecture. These guys are lucky to have you here. Thank you for coming across the Atlantic, not the Atlantic, the Pacific, to come see us.
Thank you. It's my pleasure. And your words are very kind.
One of the reasons I wanted to have this chat with you, you're actually impressively successful. When I met you, this is 25 years ago, we were kind of young, immature, and you had already a plan to move forward. And as the years have come by, I've seen the tremendous success that you have developed in your practice, and I know a lot of it has to do with the way you have set up your practice, the way you have put strategies in place, marketing in place. Can you share with us, I know like we all started with a general dentistry practice. Can you share with us a little bit of how did you set up your ortho practice within your general practice for success? And I know you work on this very hard, and we can go all night with that.
That's all
so
right.
just give us a few tips.
I always wanted to be a business person. That's what I wanted.
You are.
And then I went looking, at different areas, and I realized that I can actually be a business person with dentistry. And so then I went looking as to what it is. So the number one thing is that if you're going to do that, you actually have to commit to the career of dentistry. Just like any business person. If you're in property, you've got to commit to property. If you're into the stock market, you've got to commit to the stock market. So why not commit to dentistry? So then I went looking as to what do I need to do to start increasing what I do. And the number one thing is clinical skills. So you've got to increase your clinical skills. So if I want to do a lot of perio, well, I've got to increase my periodontal knowledge. If I want to do more porcelain work, I've got to increase my porcelain knowledge. And then if I want to do orthodontics, well, I've got to increase my orthodontic knowledge. It's just, I think orthodontics probably does take up more time from an educational point of view.
Yes, it does, actually. We can learn how to do pretty decent implant work in maybe 20 days of training, 30 days of training. Orthodontics requires a lot more than that.
Yeah, and more continuing education too, because things change and there's so many different options available to you. So setting up an orthodontic clinic, well, the first thing was I became committed to that's what I was going to do. And from a business point of view, you'd be ridiculous not to be doing orthodontics as a general dentist, because it's probably one of the most successful things you do as a general dentist. So we worked out our sums, and composites still form a major part of the practice, even though they're boring, they form a major part. But orthodontics would be probably one of the next major things that you do in your practice. Yeah. And then you've got your implants and other things.
While I was working, full-time, 15, 20 days a month, orthodontics would take about a good 50% of my practice. And in many occasions, because the way I used to work with it, it would bring more than 50% of the income.
Yeah.
Because, the restorative part, which I used to do a lot of it, has tremendous amount of expenses.
Yes.
And if something has to go back to the lab and you have to see the patient another time, you don't make money, you're actually breaking even. And with ortho, this really doesn't happen.
That's right. Because porcelain, you've got to to try in the porcelain, you've got to take off the temporaries, which means breaking the temporaries, which means remaking the temporaries. And that just takes a lot of time. But yeah, ortho became a very big part of the business strategy.
Any marketing ideas that you generated in your practice in order to, if not attract new orthodontic patients, to keep or to convert your existing patients into orthodontics? And what I mean is a lot of general dentists and general dentistry practice, and we see these. Patients go there, they get good hygiene, good perio, good restorative, and patients walk in and out, even after whitening, with crooked teeth. And like you said, maybe they need to have a little more training, but these patients need to be treated with ortho. Any strategies that you set up in place in the practice in order to be able to talk to the patients, everybody in the office, staff, doctors, so the patient would have a smooth conversion or transition from the general practice into the ortho practice?
It's all about just conversations. And so it's like we always talk about is comprehensive or comprehensive treatment. So when we have a conversation with somebody, we ask them what they want to achieve. But one line that I always do is, you never want to sell to a patient because they don't like that. Yep. So when I sit down with a new patient, I want to make sure they know what we do. So I say to them, look, we want to plan your mouth out forever, and we've got to make sure that you've got no problems, you've got no pain. We've just got to do the general stuff. And they're pretty fine with that. And then I say to them, and then after we've got your mouth nice and healthy, some people are happy to just stop there. But there's other people who want more. They want whitening, they want straightening, they want, replacing teeth. And because we do everything in our practice, I can talk about orthodontics and implants and whitening and porcelain veneers. And that's how I would probably say the line to every single new patient that comes in the practice. So the patient doesn't feel like I've been sold to, because I'm asking them what they want, but I've also told them that we do everything.
You're telling them these are the services that we provide, and
Yes.
if you're interested in correcting whatever problem you're seeing, changing that bridge for an implant restoration, or getting your teeth straight or your bite corrected, we provide that service in here.
Yes.
That entices the patient to ask you what will take to get the correction done.
Yeah. So after I've said that line, my next question to the patient is, so is there anything about your smile that you would like to change? And then I stop talking. And I just go to them, so is there anything about your smile you want to change? And then they'll tell me.
And there's
yes,
always
I have
something.
been. Yeah. So they go, yes, I thought about whitening. Yes, I thought about straightening the teeth. And I go, okay then, so we'll talk about that by the time you leave today. And then when they're in hygiene, we're always talking about things and mentioning it, but you can never do it as a sale. You've just got to mention as, oh, your teeth are a bit crooked, they're collecting a lot of bacteria, we talked about straightening them, is that something you want to talk about or not? 80% of our new patients come from referrals.
From referrals, that's fantastic.
That's right. So the other 20% come from Google, from Facebook, and from the external marketing that we do. So we work on the patients we have at the moment. So we'll send them a newsletter every now and again.
I get him once in a while. I've never been your patient, but I get him. I love him.
Yeah, so we're always, the major patients you work towards are your own patients. They're actually your best source of marketing.
Yep.
But you've still got to spend money externally, because if we get 100 new patients, 20 will be from external. Now that costs us money. So the 80 that we get are referrals from patients already in the practice. They don't cost as much to get.
Yeah.
Yeah, so it's your own patients you've got to work on.
And from what I'm reading, this is what you've been, at least I'm getting from your explanation, you're actually treating the patient with respect. You're just presenting what their needs are and telling them, I provide that service to you if you're interested. After I take care of your emergency, after I get your mouth in a much better or healthier place, we can go into all these other aspects if you like to consider them, rather than pushing, you need to get this, you need to get that. And that is what makes the patients happy.
Yes.
That's what makes them trust you more and come back to you.
Yes.
Fantastic.
So if they come in for fillings and crowns, I'll make sure at those visits go, are you still happy with the plan that we talked about? Because we're about to finish your general work. So the next stage was going to work on your smile, and you had concerns about straightening or whitening or whatever. And then I stop talking again, and they'll say, yes, I want to continue on. Or they'll say, oh yes, but I've still got a few more questions. And I go, okay, well, why don't we next time allocate some time so we can answer your questions?
And that way, you don't leave your other patients waiting for you while you're answering questions, and it allows you to prepare for a better second consultation or new consultation with your patient.
Yes. And another thing I like doing is I say to them, so what are your problems? And they go, well, they might say, I have crooked teeth. And I go, well, I'll just give you some quick options now, so when you go home, you can think about what you might want. So there's braces, there's Invisalign, and so when they come in their mind, they've already been thinking about it, so it makes that conversation a lot quicker. Yeah, because I'm not giving them the options there, because then they'll have to go home and think about it.
And then explain everything
Yes.
right there, and wait for them to think about it.
Yes. So sometimes we have everything as sheets, pamphlets that we've created ourselves. And so I go, look, I'll give you this information on these different things. Go home, read it, think about it. So when you come next time, for me, it makes it more efficient, because you can't charge for talking.
And really the only thing that we have of value in the practice is the time that we have available to work.
Yes.
And if you're spending talking, you're not treating people.
That's right.
You're just talking.
That's right, which
Yeah.
isn't what you want.
Nope.
So the more you give them to talk at home, talk to their parents or talk to their partners, talk to everybody you need to. So when you come to me, you've already spoken to everybody. Yeah. You've had the home conversations.
That makes a lot of sense. So to wrap it up, a couple of tips that you would give somebody that is either starting getting into ortho or thinking to start an ortho practice within their general practice?
Well, you've got to decide, are you committed or not? And if you're committed, then you've got to get your staff committed and on board too.
Yep, that's super important.
Yeah, because if they're not on board, then they're the ones who speak to the patients on the telephones. So it's not just training yourself, you've got to train your staff on how they're going to answer the phones. What are they going to say to patients? So how are they going to talk about everything? And another thing is for everybody is ortho does take time, because you need to diagnose. So you've got to get your family on board as well, that you may be spending certain times not at home, because you've got to do that extra work of diagnosis.
And the treatment planning.
And the second consultation, all of that. And you can't do that during clinic hours, it's got to be after hours.
After hours.
Yeah, so you can sit there and spend time. So it's sort of like you've got to get everyone on board. And if you do it, it's definitely worthwhile. And it's great, it keeps you excited doing ortho.
It does.
Yeah.
It keeps practicing dentistry fun.
That's right.
Really does.
Yeah, it keeps us going.
Well, again, it's been a pleasure having these few moments chatting with you. And I've just enjoyed watching you lecture the last 2 days. I really hope you come back to LA soon so we can hang out again. And I know you and I have a coming trip at the end of the year, actually beginning of next year, and I'm so looking forward to it. So everyone, this is my very dear friend, one of our top instructors here at POS, Dr. Agim Heimer, visiting us here in Orange County. You guys have a good night.